At Planned Parenthood, we believe everyone should have the right to make their own healthcare decisions. You are the best person to decide what's right for your family, your body, and your future. If you are pregnant, you have 3 options: abortion, adoption, and parenting. Whatever you decide, Planned Parenthood is here to help. If you choose abortion, there are 2 safe and effective ways to do so: the abortion pill or InClinic Abortion. An InClinic abortion uses suction to take a pregnancy out of your uterus. Sometimes both suction and medical tools are used as part of the InClinic dilation and evacuation, or D&E abortion. InClinic abortions are a very safe and effective way to end a pregnancy. What happens during an InClinic abortion? Before your abortion, you may need lab tests and an ultrasound to tell how long you've been pregnant. If your doctor or nurse thinks it would make your abortion safer by helping your cervix to dilate or open up before the procedure, we will give you more information about that. Your doctor or nurse will also tell you what medicines can be used to help with pain or to help you feel more relaxed. During the procedure, your doctor or nurse will do an exam to check your uterus and place a speculum in your vagina. You may get medicine to numb your cervix. If your cervix needs to be opened more, your doctor or nurse will use thin rods to stretch it. Next, a small plastic tube will be put into your uterus through your vagina and emptied with suction by a handheld or electric suction machine. Medical tools may be put into the uterus as well, depending on how long you've been pregnant. As your uterus gets smaller during and after the abortion, you may feel cramping. After your abortion, you will rest in a recovery area. Most people are ready to leave after 15 to 45 minutes. If you receive sedation through an IV, you will stay in the recovery room for at least 30 minutes. You'll be given instructions on what to expect, how to care for yourself, and reasons you might need to contact us. What are the risks? As with any medical procedure, there are risks. Complications from InClinic abortions are rare, but you should have all the information you need to make the best decision for you. There are some rare complications that may require another suction procedure. For instance, if the abortion does not end the pregnancy, or if there are blood clots in the uterus, which can cause cramping and belly pain. An incomplete abortion means some of the pregnancy tissue is left inside your uterus. This may lead to heavy bleeding, infection, or both. If this happens, you may also need other tests or treatments. Bleeding too much or too long may also require treatment with medicine, blood transfusion, or surgery. You could also experience an infection of the uterus. Usually, this is treated with medicines, but there's a small chance you might need another suction procedure. There is also a small risk of injury from the medical tools used during the abortion. Treatment for these kinds of injuries may mean just watching and waiting, or may require surgery. There is a very small chance you may need a hysterectomy, surgically removing the uterus, if there is severe damage to your uterus. Some people may have an allergic reaction to the medicines used in an InClinic abortion. While extremely rare, as with any medical procedure, there is a risk of death. Abortions within 20 weeks of pregnancy have less risk of death than getting your wisdom teeth removed or childbirth. Certain risks may be higher if you have had a C-section or other surgery on your uterus in the past. What should I expect? Most people return to their normal activities the next day, but plan a day of rest if you can. Make sure to get any medicines you are prescribed for antibiotics, birth control, or other medicine. Side effects include cramping and light or medium bleeding that's different from your period. These symptoms don't usually last long or need to be treated. It's also normal to have heavy bleeding for a few days, spotting that lasts up to 6 weeks, bleeding that stops and starts again, or even no bleeding. Using maxi pads at first makes it easier to tell how much you are bleeding. You can use tampons when the bleeding is lighter. If you have cramps, you can use a heating pad, a hot bath or shower, pain medicine, or rest. If you have had breast tenderness, it should go away in a few days. It's rare, but you could leak a milky discharge for 1 or 2 days, which can be managed by wearing a snug-fitting bra or chest binder. If you are not using birth control, you should have a period within 8 weeks of your abortion. Call us if you aren't using birth control and don't get a period within 8 weeks. You can exercise and have sex as soon as you feel ready. Remember, you can get pregnant again within 2 weeks of the procedure. If you do not want to become pregnant, talk to us about birth control. When should I call for help? You can always call us if you have any questions or concerns, but there are some situations when you should call us right away for help. If you have a fever of 100.4 degrees Fahrenheit or higher, belly pain or cramps that don't get better with pain medicine, if you soak 2 maxi pads an hour for more than 2 hours, if you have bad-smelling vaginal discharge, or if you still feel pregnant, call us right away. It's totally normal to feel a wide range of emotions after an abortion. The most common feeling people have after an abortion is relief. If your moods worry you or keep you from your daily life, call us. We can help, or we can provide resources to connect you with someone who can help. If you have any questions or concerns, please call us. We're here to help. Your health is important to us.